Hey guys, Dr. Joe Borio here, right at my office, right at lunch break. I had a woman come in today, and she has been suffering from severe neck pain and has suffered for years from it. Causes a tremendous amount of stiffness in her neck, and it also causes a lot of headaches. And why I think I felt compelled to have a video live today with you is, here's a woman who doesn't know there's hope or help for her. Here's a woman who has been pounding medication that has significant side effects and has seen many other people well-intended in an effort to try to help her out, but because no one has really explained to her what's going on or why she's having the problems, the severity, the concern of it, she's only been exposed to those traditional choices that most people think are out there, and those are the only things that she thought would help her out. So when we evaluate her, we sit her down as we do with you when you come into the office. And then we take some x-rays of her. We have a chance to see not where she's sick on the outside, but where she's sick on the inside. What's going on inside her that's actually causing her to be so sick and not be well. And not only that, once you know where she's sick and why she's sick, if you will, right, inside her body, just like I would with you, then we can set a plan in order to get you well, correct what's truly causing the problem and get you well. And that way, those people, not only is it less meds and less invasive procedures and such, which certainly have a place, right? But it's really about quality of life, isn't it? Isn't it just about, hey, listen, I feel good, and it's not just that loss of pain or improved function, but you're like, wow, I can lead and live a better life. I can enjoy my weekends more. Or maybe you want to do something local here and go to the Carrier Dome for an event, right? Or go watch your son play a football or lacrosse, or sit there with your grandkids or whatever. All of a sudden that becomes something you can't enjoy anymore because you're so sick or damaged. So getting your health back is going to allow you to be able to live your life better and allow you to do those things. So let's go over real quick. I just want to go over this. I think it's so important because it's information that most people just don't know. You just don't know, right? So when we look at a neck, for example, here in your spine, all right? So this picture on the left side is a photograph, an x-ray of somebody that comes in my office, and they have a normal spine. They have a healthy, normal spine, okay? So in this case, you're going to see the head is over the shoulders. You're going to see a curvature in their neck, right, your neck, and you're going to see some gaps in between the vertebrae, in between the spine, okay? Now that is the structure in the anatomy of a healthy spine. Why is that important? I'm coming in and out of my camera here, but so if I look at your spine, here's a vertebrae, here's your disc, and that's a hole, and that's where the nerve comes out. So let's look at that just real briefly here. That's critical because what happens is the integrity of all that tissue allows for normal function, and it allows that nerve to be healthy. And we'll talk about that in a minute, right? So what happens is if my spine, and I think it makes sense to most people, if my spine is crooked, if it's twisted, crooked, out of alignment, can you see where it would cause more pressure here on that joint? So what's going to happen to that joint? What's going to happen to that disc? What's going to happen to this joint here above my thumb? What's going to happen to the nerve on that side, right? So all that tissue is going to what? It's going to deteriorate, and that nerve is going to be irritated, and that joint's going to be irritated. And now what am I going to start to exhibit? And it doesn't happen overnight, right? Even though your symptoms may start overnight, what's going to happen is that area is going to get sicker and deteriorating, right? And then what's going to happen is I'm not going to feel good. So then I say, Jesus, I don't feel so good. I'm hurting. So again, most people, doesn't make you a bad person. You go down the hall, you above the sink in the bathroom or on the left side of the kitchen cabinets, and you got some pills in there. So we start swallowing that down. So think about that. If this is crooked or damaged, how is Advil, number one, right? I'm not saying never take it. I'm saying, how is Advil going to fix that? It may minimize the discomfort, right? But how is it going to fix that? How is it going to straighten that area of the spine out, right? So that area is crooked. There's only one way to do it, and that is to get on there physically and push it, or what we call an adjustment, adjust that area back into better alignment. So let's talk about what that looks like. Because if this is normal, both of these people are of the age of 40. So here's somebody on the left, normal curvature, normal alignment. You know, they're 40, but they're a healthy 40, right? And then we come into this person here, right? So what's this person look like, right? So look at the structure and compare the two, right? You've got no curve, your head's out in front, which is common with our society now, texting and phone and looking at computers and paperwork, so we're leaning forward. And what's happened to all those spaces down here? Look at it, right? See how they're all, what's happening here, right? They're deteriorating. So now what's happening is that space that was like this is now like that. So what's happening to the nerve? What's happening to the joint? So because the spine's been stressed or strained, the joint deteriorates and the nerve gets compromised. So now I'm dealing with deterioration, discomfort from deterioration, but most importantly, I'm dealing with a very specific and unique word to chiropractic, and that's subluxation. So like a dentist would look for gingivitis, right? Or a heart doctor is going to look for arterial sclerosis. Chiropractors are looking for where the spine is subluxated. Where is the spine out of alignment? Kind of like an orthodontist. I think I got some dental pictures here. Like an orthodontist, for example, would look at your teeth to see where your teeth are crooked, right? The chiropractor's looking to see, you know, doctors in our field are specialists and looking in to identify where this is crooked. Because I know what's going to happen without any hesitation, right? Science tells us this. The minute you lose alignment or mobility, the moment you lose it, you start to deteriorate the spine and you start to immediately damage the nerve. Now, you may not hurt right away, right? You may not feel anything. You're not going to feel sickness in the beginning because symptoms are often the last stage of a problem, not the first, right? So if you look at, for example, an artery in your heart, right? Let's say that's a normal artery hole, right? So, hey, all the blood flow's going through my heart, everything's good. Your arteries in your heart can be that plugged, right? It can be that plugged before you'd ever say, ouch, before you ever had angina, before you ever said, I don't feel good, they can be plugged that much. Now, a lot of times people think, hey, the onset of the pain, they tend to think that's the onset of the condition. Rarely that's the case. That's the last stage of the condition because the body can no longer deal with the pain or the discomfort, right? So if we think about this in the human body, and we're looking at the spine, this is an example of your nerve. So your nerve comes out of that hole, right? It comes out of the neck, right? It's coming out of that vertebrae. So if you think about it this way, there's the nerve coming out of that vertebrae, right? And that nerve goes where? Hey, it goes down to my arm, right? Goes down to my neck, my arm, my hand, right? We pretty much have a handle on that. I think most people know that, right? What we forget is that nerve also goes where? And it goes to my heart, goes to my lung. It can affect my sinuses. Like we forget, even though we know it, that every nerve in your brain has to go through your spine in order to get to the body and the organs. So if your spine is jacked up, jammed up, twisted, jerked around, it happens through life, doesn't it? Car accidents and falls and posture and all things that we do, that spine gets crooked. And then what happens is it starts to jam up on that vertebrae, which then jams up on those nerves, which then what's going to happen? Let me ask you this. What's going to happen to the inside of your body? What's going to happen to the organs on the inside of your body when the spine's crooked and the nerves are pressed on? Like what's going to happen to your heart? Is your heart going to get healthier or sicker? Is your lungs, are they going to get healthier or sicker? What about your thyroid? What about your sinuses? How's your body going to let you know it's really sick? How's your body going to let you know there's a problem? Right? Your body's going to give you symptoms. So symptoms aren't an indicator by nature to say, hey, listen, time to take another Advil. Symptoms are in your body to say, hey, listen, hey, Joe, time out. I'm not well. I'm sick inside. Something's wrong inside my body. And as chiropractors, our job is to look inside you, inside your body, to see where the spine is crooked. Where is it, again, that word that we're specialists in as chiropractors, that subluxation. Where is it crooked? Where is it misaligned? And then through a series of adjustments, we're going to realign the spine. Now, sometimes that's a concern people have. Hey, money and time, right? Money and time. I don't want to get into something. And I can appreciate that. But the reality is, if you're older or there's more damage and there's more decay and there's more complications, let's say, that person, I think that makes sense. Would that person require less time or more time than somebody who's younger with less complications, with less damage, right? But the reality is, when you go to the chiropractor, we're looking to see where this is crooked. We're going to push on it, realign it, and then what's going to happen is what? That vertebrae is going to go back because it's been out for 20 or 30 years, right? So then I'm going to push on it again, and it's going to go back out of alignment. I'm going to push on it again, and it's going to go back out of alignment. And eventually what happens is, the great news is, you get people that are in this area, and they're never going to be this good again, but those people can get healthier. So what does that mean to you? That means to you, hey, I feel better. I'm more functional. My thyroid works better. My breathing's better. My heart's better. I'm more comfortable. I can enjoy the night. I can enjoy the day. I can enjoy being with my family. My headaches are gone or less. My discomfort in my neck, my stiffness in my neck. My body, just like a piece of machinery, my body works better. My body's healthier. Ultimately, that's always the job of a chiropractor. Not really to necessarily treat anybody. Our job is to take care of it, right? So quickly here in my final moments, this is a toothbrush. One of the things I always ask people is, because I'll have people say, about care or frequency of care or maintenance care, I always ask people, what is my job? Once I get you well, what's my job? And almost everybody say maintenance, right? So almost everybody says, hey, to take care of it. And that's the reality of it. If you think of taking care of your spine like you would your teeth, you would get adjustments like you would brush and floss your teeth regularly, not because it's sick, but so that it doesn't get sick, right? So the job of a chiropractor, the most powerful aspect of what we do as chiropractors is, and certainly what we focus on in our office, is wellness care, thriving care. Most people are surviving. They're not really thriving. They're not like, wow, I'm getting better and healthier as time passes. They're like, wow, I'm just mitigating how lousy I feel as time passes, right? And it starts to become normal. It's not normal to be sick and diseased. That's not the normal state of your body's health and function. That's not the way you were designed to be. So short of some genetic challenge, 99.8% of us were born perfectly healthy and functional and well. And that's the way our life and body should function, right? So we get so used to thinking, hey, Jesus, if I'm not feeling good, I'm sick and diseased. It's normal to fall apart or get sick and diseased when you get older. So let me ask you this. These right here, how long are these meant to last for? How long, right? Most people say forever. And that's true, but only if you take care of them, right? Only if you got one of these in a floss are these going to last you, your 100 or 120 years, whatever your blessing is to be on the planet here, right? Only if you do that. If you don't take care of them, if you don't brush or floss, and you say, the hell with it, I'm not going to do it, what's going to happen to your teeth? Are they going to get healthier or sicker? So they're not going to last as long. So that's one part that people forget. But just ask yourself this. If these are meant to last as long, a lifetime, right? So is your gallbladder. So is your spine, so is your knee, so is your thyroid, right? It wasn't like God got your teeth figured out, but couldn't figure out your gallbladder or your appendix or your adenoids or tonsils, right? So if we know that, if we could start from that premise, then before we start trying to peel something away, or before we decide one day, hey, let's cut that part out, that organ out, maybe the best answer would be to look inside and check the integrity of our nervous system, right? And then check the integrity of our spine. You know, I started today's conversation talking about a woman who was in my office just today. And so that was my inspiration why I listed, you know, do you suffer from neck discomfort or stiffness or headaches? You know, certainly it could be any type of indicated that your body's telling you sick, whether it's your lower back, whether you have breathing trouble, whether your kids have some neurologic challenges. But even if you're sitting there listening to this and you're like, wow, you know what? I feel pretty good, you'd still brush and floss, wouldn't you? Right? So regardless of how you feel, or regardless of how healthy you think you are, or healthy your children are, you know, the reality is always, just like a dentist, if you think of what I do as a dentist of the spine, hey, let's get in to see Dr. Joe, let's get in to check my spine, let's get in and get some adjustments to my spine to keep it healthy so it doesn't get sick, just like you brush off plaques so your teeth don't rot, right? Just like you exercise so your body stays healthy, just like you eat good so you don't get the sickness and disease from eating bad. The adjustment is critical and necessary for all of us in order to keep the spine and nervous system healthy throughout our lifetime. If you're like most people, and again, I'm not saying that out of judgment because most people come into my office and you think, well, there's a fear, there's a train wreck, or my body's not doing so good. You know, ignoring it is only going to do what? It's only gonna allow it to get worse, right? So the reality is, get in as soon as possible. Let's check you. Let's see where you're at, regardless how bad it is, because something is always better than nothing. Something's always better than nothing. So I listed it up there for the month of December. We find people probably neglect their health at the greatest level in the month of December. So for the month of December, as an effort to give you an incentive, and that's truly why I give you a savings for that, to drive an incentive for the month of December, you can come in and get evaluated, an x-rayed, an examination in our office for $37. Part of that is an incentive. The other part is this: I don't want to see money, you know, some exorbitant fee prevent you from coming in and getting checked. I don't want to see somebody say, geez, that's so much that I wouldn't even want to come in and get evaluated or try something I'm unfamiliar with. So my attitude is, come in, get checked. It'll be $37. And then you and I will sit down afterwards. We'll discuss what we found, right? We'll have that conversation. At the very least, at least you know what's going on inside your body. And at the best, you and I can sit down and say, hey, listen, this is what's ideal based upon your age and based upon the damage in your spine. And this is what would be in your best interest to get well. And you're either going to say, yeah, that's great, let's go for it. Or you might say, hey, I can't do that, but I can do this. Well, that's a lot better than this, right? And worst case, you know, if you came in and the office doesn't resonate with you, or I don't resonate with you, or you don't like how we do things in the office, I'm always going to shake your hand, tell you, listen, you know, I love you, and we're going to make sure you get somewhere to get some great care. But in the end, our office is about taking care of you. It's an office that, you know, not only loves what we do, but we want all of you to live the way you were designed to live. And I don't think most people, you know, it's kind of sad, but I don't even think most people know what normal is. I think most people know what they are, but how they're functioning and how they're feeling and what they're able to do and not able to do, and you know, the 3 pills they're taking every day, and the ologist that they all have in their life, you know, that becomes so normal that you don't even know what normal is anymore, because that isn't the way, you know, we're meant to live. That isn't the way you were meant to live your life. That certainly isn't the way that, you know, God and the universe designed you to be, right? So our office is about, you know, regaining that health, getting your body to thrive, getting your body to function exactly like it was supposed to. So I gave you a couple examples. We're going to be doing some weekly videos here. We're going to be showing you some x-rays and MRIs, and we're going to be going over the anatomy and the physiology of the body, and we're going to be discussing, you know, different health challenges that people have, because a lot of times I think a lot of the public either doesn't know what we do as chiropractors, or they think something is relevant to chiropractic, but they might think that something else isn't relevant to chiropractic. And the reality is, everything's relevant to the health of your spine and nervous system. I mean, what's your brain control? Think about that. What's your brain control? Your brain controls everything, right? So if your brain controls everything and there's a way to get your brain to communicate better to the body, then keeping the spine healthy and keeping your nerves healthy means that you can help everything. That means your body will work better because you're able to help everything with a healthier nervous system. So give us a call. Our number's right down there. It's 315-699-1441. And my staff's around for the rest of the afternoon today. You can leave your name and number. We'll be back in the office tomorrow. We're here tonight till 6 o'clock. And they'll be happy to meet you, set up a time for you to come in and get checked. I'd love to meet you and love to hear what's going on in your body and have that, hear your story. Let's find out where you used to be, and let's discuss, the two of us, how we can get you back there. And then most importantly, how we can keep you there, right? How we can keep you there. That's truly what our office is about. And we're a huge family office. So anybody that's seen pictures of our office here, you're going to see we have tables for children, and each room has a theme. We got a dinosaur room and a Winnie the Pooh room and a Toy Story room and such. So it makes it really comfortable and inviting for children as well, so that your family can come in and your children can get checked. And sometimes I have parents go, why would kids need care? Well, so they don't look like you when they get that age, right? It's kind of like, why would you brush your teeth, right? You don't want them to rot out when they get older, so I don't want to see their spine get sick and damaged like yours did. I say that with love. I'm not saying that out of any judgment. So, because most people don't know what we do, right? So give us a call. You can also look us up on the internet, which is either Dr. Joe Borio, DrJoeBorio.com. That'll bring you right to our website, or BorioChiropractic.com. That'll bring you right to our website. And again, I'd love to have the opportunity to meet you and your family. And it really is an honor when somebody comes into us and says, hey, listen, we're looking at you to take care of us. And that isn't something that goes unrecognized. And you put a lot of faith in me in order to do a great job for you and your family. And that's something that, again, I recognize and I honor, and I certainly will always do my best to take the best care of you and your family as I possibly can. So guys, have a wonderful afternoon. Give us a call again in the office. If you like what you're hearing on the video and you've got a friend, a family member, a coworker, a loved one, share the link and let them benefit from some of this information that we shared with you today, okay? In the meantime, have a very healthy, wonderful Thursday, and I'm sure I'll talk to you here within the next few days when you call, or we'll talk on next week's video. Thanks so much.